Right from the beginning, when I was a child, my father, being a medical doctor, had journals, medical journals around the house, and I really enjoyed reading those. So that captured my interest in healthcare. From a hands-on perspective, I actually enjoy doing that. My father suggested, get into dentistry, we'll have the mix of medical knowledge and translating that into hands-on application. So hence I've started studying in dentistry in the Queensland University in 1992. Following graduating in 1997, I worked for a while with the Air Force, and during that time unfortunately had a DVT in my left leg and really became interested in studying more, learning more about my condition, which once I had my head around, I was really hooked on the addiction of academia again. This led to me starting the primaries with the Royal Australasian College of Dental Surgeons in 1998, and that thirst for knowledge and translating that into clinical skills led me into being an oral and maxillofacial surgery registrar at the Royal Hobart Hospital in the year 2001. It's a particularly interesting area where dealing with a lot of trauma and infections and a lot of advanced surgical procedures required to manage those in an inpatient setting. I was the only dentist on call for all of Tasmania for the whole year, 24 hours a day, 7 days straight. So quite an interesting job, exposed to quite a lot of events. That led me into an accredited training program at the Royal Adelaide Hospital and also rotations through the Royal Darwin Hospital. It was there where I met my wife and had time at that stage to have experienced what is it like to be an oral and maxillofacial surgeon. The specialty itself is really evolving as far as taking on medicine and surgical training and a lot of large surgical procedures, which really I felt was moving too far away from the oral cavity, from dentistry. So I resigned from oral and maxillofacial surgery in 2002, 2003 and worked as a general practitioner again for a couple of years. It was during that stage when I was doing some continuing education at different conferences where I became exposed to dental implants. Now, the evolution of dental implants since I went through university has been amazing to see the technology evolve, and particularly the predictability of these being successful. So I really became interested in that facet. I went along and assisted a periodontist and worked with him part-time on the Sunshine Coast, and I became exposed to all facets of periodontics, and that includes not just placing implants but also treating periodontitis. And that was really an eye-opener as well, to see how over time, whereby previously people would have had all of their teeth removed, and even I was exposed to that as an undergraduate dental student, nowadays I was finding that you can save a lot of those teeth. So that was a real eye-opener and particularly exciting. And then still from there, in addition to saving those teeth, you can actually grow the gum and the bone back. And I was completely blown away. So I started really becoming interested in periodontics, which captured the ability to save teeth, which I previously had been taught were hopeless. And also, should you have lost those teeth, some great techniques and technology to place new implants in those sites. I was successful in becoming a registrar in the Masters of Dental Science at the Oral Health Centre at Western Australia in 2005-2006, whereby I did a 3-year Masters training full-time in periodontics. Following completion of the Masters of Dental Science in 2008, my wife and my 2 kids, Ali and Lauren, decided we should do some exploring of Australia. We travel around Australia quite a bit, and we settled in Perth again in 2009, whereby I've been working at a number of premises north and south of the river, but most recently have gone into my own practice in South Lake. I'm delighted at the position we're in and accessibility for patients. I was really listening to people when they'd see us in West Perth for the accessibility being poor, the car parking being poor, the Kwinana Freeway really getting to a gridlock, and have found the accessibility here fantastic for patients' access. Our team here enjoy immensely working together, and we're committed to continuing education for myself, but also for the team. One of our nurses particularly loves infection control, which is essential for your sterility of your instruments which are coming through the autoclave and being used each day. And we go on courses together on infection control, theatre techniques, and a number of other courses which are clinically relevant for us to continue practicing as a very successful team.